Good morning friends, welcome on my channel Charming Science. Today we are going to talk about a bone, hamate. So hamate is the bone situated within the intrinsic structure of the wrist, which consists of two rows of carpal bones. The proximal rows include the scaphoid, lunate, triquetrum and the pisiform, and in the distal rows include the trapezium, trapezoid, capitate and hamate. The hamate is a part of distal rows and occupies the most medial, that is the ulnar side position in this row. It serves as a bridge between the carpal bones and the metacarpal, particularly the fourth and the fifth metacarpals. When we talk about the shapes and structures of the hamate bone has several distinguished features that it is also known as a wedge-shaped bone. So the hamate is also known as the wedge-shaped bone because the body of a hamate is roughly triangular or having a wedge shaped. There is a structure that is present in a hamate that is a hook of hamate. So the hook of hamate, the anatomical position of that, the hook projects anteriorly palmar side from the body of the hamate, and this is a very important structure of hamate because it provides the attachment to various ligament and provide a way of the Guy's canal. It acts as a part of the component of the Guy's canal, which is an important structure that is present in our wrist. When we talk about the surfaces of the hamate bone, then we have a dorsal surface, palmar surface and the proximal surfaces. When we see the dorsal surfaces at the back of the hand of the side, we will find that the dorsal surface having a convex and relatively rough than the other sides and provide attachment for the dorsal carpal ligaments. It is clinically important because it can be palpated through the skin in the wrist dorsal region, especially when there is a fracture or dislocation presented in the hamate. When we see the palmar surface of the hamate bone, we will find that it's having a concavity structures. So in the dorsal surface, we will find that it's having a convex structure, convex and rough structure, but in the palmar surface, we will find that it's a concave structure, and it provide their contribution in forming the carpal tunnel, carpal arches and the carpal tunnel. There is also anteriorly we written that the anteriorly the hook of hamate is also present. So the hook of hamate, a prominent site for the fracture of the palmar surface, forming a part of a Guy's canal and serve as a landmark for various clinical procedure. The proximal surface is having an articulation with the lunate bone and contribute to the stability and the movement of the midcarpal joint. The function of the proximal surface is play a role in the transmissions of force during wrist flexion and extensions. We are having a distal surfaces. So in the distal surfaces it articulate with the surfaces of the base of the fourth and the fifth metacarpal, and this connection is crucial for the movement and stability of the ring and the little fingers, because the metacarpal of the fourth and the fifth metacarpal provide the stability and act as a role of providing the stability to the fourth and the fifth fingers. It provides these articulation allow for slight gliding and rotational movement necessary for gripping and manipulating the objects. And in some books, it is known as the saddle type of joints. Medial surfaces, articulation with the triquetrum, and this surface form a joint with the triquetrum, indicate and intricate ulnar movements and contribute to the wrist stability. The stability role helps to stabilize the ulnar side of the wrist, particularly during the ulnar deviation. It's having a lateral surfaces. The lateral surfaces articulate with the capitate bone and form a central column of the wrist and aiding in the distribution of forces across the carpals. The lateral surface will also contribute to the mid-carpal joint, and this articulation with the capitate allows the complex range of motion seen in the wrist. When we talk about the articulation of the hamate bone, we will find that it make a joint with the capitate, lunate and triquetrum. So when we see the joint for the capitate bone, this is the surface that's form the capitate bone, as we read before that it also provides the surfaces with the capitate, share their surfaces with the capitate, metacarpals, lunates and triquetrum bone. So while forming the articulation with the capitate bone, it's a planar type joint or the plane joint, and it allows the sliding and rotational movement which is necessary for the wrist flexibility. It also form a joint with the lunate, and it's also a plane joint type of plane joint and provide in the movement of the flexion and extension of the wrist, and also provide the smoothness or provide the smooth transmission of forces or the distribution of forces in the among the carpal bone and from the carpal to the hand or the forearm. The triquetrum is also form a plane joint, and its function is to support ulnar deviation and stability of the ulnar side of the wrist. There is having the distal surfaces that is formed by the fourth and the fifth metacarpal, articulate with the fourth and the fifth metacarpal bone. Some book says that it's a plane joint, and some book also says that it is a saddle joint, because when we see the anatomical structure, then the first, second fingers joints are the plane, the approximately purely plane joint. The approximately word is because they are always having a some movement. There is not any joint in our joint which provide a fixed movement. So if it's a plane joint, along with the gliding, there will also be some type of rotational movement will also occur there. So according to books, some books first seconds are the complete plane joint, but during the ulnar deviation, because the ulnar deviation range is higher than the radial deviation, the third and the fourth finger, the ring and the little finger joints, will act like as a saddle joints, and that's because of they also provide the greater range of motion in the ulnar deviation. So the hamate make a joint with the fourth and the fifth metacarpal. It's a saddle type of joint and provide the flexibility and mobility required for the movement of the ring and little finger, essential for gripping and manipulating the objects. When we talk about the ligamentous and tendon attachments on it, there's lot of ligaments and the tendon attach on a hamate, and they all provide the stability and increase the hand's functionality. So first of all, the palmar carpal ligaments. These ligaments attach the hamate to the adjacent carpal bone and the base of the fourth and the fifth metacarpal bone, providing structural support. The another ligament is the transverse carpal ligament. It is also known as the flexor retinaculum or the part of the flexor retinaculum. The attachment it provides attach the hook of the hamate and extends across to the other carpal bones, including the pisiform, scaphoid, tubercle and trapezium. The function of this ligament is from the roof of the carpal tunnel and securing the flexor tendon and the median nerve within the tunnel. There is another ligament, that is ulnar collateral ligament. Its function is it extends from the ulnar styloid process to the triquetrum and the hamate and providing stability to the medial aspect of the wrist. The muscles and the tendons that is attached to the hamate is the flexor carpi ulnaris. It inserts near the hook or the anterior surface of the hamate, near the hook of the hamate and the pisiform, and the function of it is flexes and adducts the wrist and playing a significant role in wrist stabilization and movement. Flexor digiti minimi brevis. It originates from the hook of the hamate and flexor retinaculum, and its function is to flex the little finger at the metacarpophalangeal joint and contribute to the hand dexterity. When we talk about the vascular supply of the hamate bone, the hamate bone receives blood supply from the branches of both the radial and ulnar arteries. The ulnar arteries, coming from the Guy's canal, the ulnar arteries passes close to the hook of hamate within Guy's canals and giving off branches that supply the hamate and adjacent structures. Palmar carpal branch contribute to the blood supply of the hamate and surrounding carpal bone, ensuring adequate nourishment for bone and ligament health. The radial artery, the radial part of radial artery superficial palmar branch provide indirectly supply to the hamate through the palmar carpal arch, which connect the ulnar artery to form a vascular network around the carpal bone. These arteries ensure that the hamate receive the necessary nutrients and oxygen crucial for maintaining the bone health and aiding in repair process after injuries. When we talk about the innervation of the hamate bone, we will find the sensory and the motor innervation around the hamate bone is primarily provided by the ulnar and the median nerve. The ulnar nerve travels through the Guy's canal and situated close to the hook of hamate, and the innervation provides motor innervation to the intrinsic hand muscles and sensory innervation to the skin of the ulnar side of the hand, including the little finger and the ulnar half of the ring finger. The median nerve is proximity to the carpal tunnel. While primarily involved with the carpal tunnel, the median nerve provides sensory and motor function of the thumb, index and middle finger and indirectly impact the functional region around the hamate. When we talk about the ossification centers of the hamate, then we will find that it's having only one primary ossification center, and the primary ossification center of the hamate bone typically appear around the 1 to 6 months after the birth, and the location is the center in the form of hamate or in the center of the hamate bone. The complete full ossification of there is not having a secondary ossification center in the hamate bone. There is only a primary ossification center present in it. The full ossification center, the full ossification will take around or the completed around the 8 to 13 years of the age, and this process involves the gradual replacement of the cartilage by bone until the structure is fully developed. So the full ossification will occur around the 8 to 13 year and start from the 1 to 6 months after the birth. The secondary ossification center, the hamate bone does not have a secondary ossification center. It ossifies from a single primary center and there are no additional center developed later in it. What are the clinical significance of the hamate? The fracture, the hook of hamate fractures. So typically the result from the direct trauma or stress related injuries common in the sports while gripping like golf, baseball and racket sports, and also while catching the ball in the cricket. Symptom pain on the ulnar side of the wrist and decreased grip strength and possibly numbness in the ulnar nerve is involved. The diagnosis through specialized imaging tests such as X-ray or the CT scan will required for diagnosing it, and the treatment include the immobilization, splinting or the surgical fixation of the hook of hamate. The another clinical significance is the Guy's canal syndrome. Guy's canal syndrome is a syndrome in which the ulnar nerve will compress in the Guy's canal due to the having the repetitive trauma or the having the anatomical variation or having the compressions in the Guy's canal. The symptoms includes the numbness and the tingling sensation in the area where the ulnar nerve supplies, as is the ring and the little finger, and it also provides the weakness in the hands of the intrinsic muscles and possibly atrophy of the hypothenar eminence. Diagnosis: for diagnosing it, we have an EMG and NCV test that help us to diagnose the Gans canal syndrome, and the treatment required for the Gans canal syndrome is the conservative measurements such as the splinting and the anti-inflammatory medications, and sometimes the surgical removal of the compression site or the decompressing the Gans canal will help. The another clinical significance in the ulnar artery thrombosis. This also occurs due to the repetitive trauma or the pressure on the ulnar artery near the hook of Hamate, and it can lead to the thrombosis and reducing blood flow to the hands. Symptoms can include pain, cold intolerance, and pallor in the affected finger, particularly on the ulnar side. The diagnosis and the treatment: vascular imaging tests such as the Doppler test or the another test, or possibly surgical intervention are used to restore the adequate blood flow. The relationship with the carpal tunnel: proximity, the Hamate's hooks and the proximity of the transverse carpal ligament means it can influence conditions like carpal tunnel syndrome. Impact: injury or abnormalities in the hamate can affect the carpal tunnel function, and given the interconnected nature of the wrist and the anatomy. The imaging and the diagnostic techniques that is used for the seeing the anatomy of the hamate. Understanding the anatomy of the hamate bone is crucial for accurate diagnosis and treatment planning, especially in case of an injury or pathology. So some x-rays will be used, and CT scans and the MRI. In the standard imaging, we will the primary modality for visualizing fracture, especially in the acute setting, and there are some special view that is present for the checking, visualizing the hook of hamate more clearly. So that special view is also known as the carpal tunnel view or the supinated oblique view. It's a type of view when we want to see the hook of hamate more clearly and want to see the fracture of the hook of hamate, then we take the carpal tunnel view or the supinated oblique view in an X-ray. For the while doing the CT scan provide detailed cross-sectional images which are excellent for assessing complex fracture and anatomical variation, particularly useful in planning surgical intervention or evaluating the healing of fractures. In MRI scans, we also see the soft tissue visualization and MRI for visualizing soft tissue including ligaments, tendon and nerves, and indication useful in suspected ligamentous injury and nerve entrapment or vascular issues affecting the hamate. There are some surgical approaches we consider in the conditions of the related from the hamate of bone. So there are the conditions that is gone for the surgical approaches such as the fracture of the hamate or the decompression of the Gans canals and having any anatomical variation present in the hamate bone. The surgical approaches for fracture: the surgical fixation may involve screws or pins, especially in case of hook or the fracture or non-union of hamate. The Gans, while in the Gans canal, decompressions involve releasing the structure of compressing the ulnar nerve within the canal and often necessitating careful dissections around the hook of hamate. There are some complications that occur in this case, that is the injury to the ulnar nerve or ulnar artery due to their proximity to the hook of hamate. These structures are at the most risk during the surgical procedure, and in case of the fracture or the fracture of the hook of hamate, the non-union of fracture, the unique shape and blood supply of the hamate can lead to challenges in healing, particularly in the fracture of the hook of the hamate. That's all for the hamate bone. If you like then please like this video, then please like our video, subscribe our channel, like and share, also share it our channel. Thank you very much.